Okay, good afternoon, everybody. It's 1 o'clock, Wednesday, October 14th, 2020. This is the Calhoun County Joint Information Center briefing. Some administrative notes. If you would please mute your phone and send any questions through Zoom, the chat function, and that will be handled directly by Lucy and Jessica. Next slide, please.
Dirk, can you hang on a second? I don't think we're streaming.
I sure can.
Thank you.
You bet.
Jessica, are we streaming this to Facebook today?
Yes, ma'am.
Oh, okay. Sorry about that. Hold on.
Okay, standing by.
Sorry about that, Dirk. You're all set now.
Okay, thank you very much, Sarah. Calhoun County Joint Information Center briefing for Wednesday, October 14th, 2020, for those of you just joining us now on Facebook. Our Unified Command Team, Kelly Scott, Calhoun County Administrator Controller, and today in for Rebecca Fleury, our City Manager, is the Assistant City Manager, Ted Deering for Battle Creek, and Eric Pessel, Calhoun County Public Health Department Officer. Next slide. Okay, additional speakers. Dr. William Nettleton from the Calhoun County, he is the Calhoun County Medical Director. Steve Hinckley, Calhoun County Sheriff, and Jill Steele, the attorney for the City of Battle Creek. Next slide, please. And next slide, please. The purpose of the Joint Information Center, JIC, I'll let you read that for a second. And next slide to our agenda. Okay, our first speaker today is going to be Eric Pessel to discuss our current situation. Eric?
Well, thank you, Dirk, and good afternoon, everybody that's able to join in and listen in and even watch on Facebook. I'd like to start out by saying that, things have not gotten a whole lot better from probably the last time we met. Our numbers do continue to surge upward. Our positive count as of 10 a.m. this morning was at 1,754 cases. We have 134 total hospitalizations currently, and that's the number that we are watching very carefully. We have 24 COVID patients in our that make up in our two hospitals here in Calhoun County. And we've had 48 deaths. And then the graph, as you can see on the right, that's our that's over since the beginning. You can see since March, that's our case count. And obviously back about mid to late September, you see the surge that we are feeling, and it is continuing. And later today, Dr. Nettleton is going to give us some great insight on some of the reasons why and what we're seeing, the makeup of that surge. Next slide. This is I call it a day in the time of just the reality at the public health department and what we see in any given day and what that means as far as ongoing workload throughout each day. So in comparison from October 5th, on that day, we had 178 confirmed cases that we were currently following. On October 14th, we have 167 cases that we're currently following. I would notice and take note at the bottom number, there's 858 cases on October 5th between close contacts, probables, and confirmed that staff would have needed to reach out to on that particular day. And then you can see it's gotten a little bit better on October 14th, where we're not seeing quite as many close contacts, even though we're still seeing high numbers of cases. And I think Doc will be able to show you in some of our data why that is. Some of the surge in our cases are from people that are already quarantined, which means that they didn't have close contacts because they were already home. Next slide. Just go through some of the epidemiology of our symptoms. I think this is important for everybody to notice because we've heard all over and over, the types of symptoms that are COVID symptoms. And here's a long list. These are all of our cases that we've had to date. These are the highest ranking symptoms that they had. I would like you to take note that the cough, which is a new cough, is our number one symptom. And I want you to take note that fever is our, number 5 symptom. So sometimes I think I've heard people really, their whole screening process is just to take somebody's temperature. Only about 56% of our cases have presented with a fever or a high temperature. It's more likely you're going to have a cough, you're going to feel tired, lethargic, you're feeling weak, you have a headache, and you have a muscle ache. Those are the predominant symptoms of COVID. And I think it's important for all of us to recognize those and continue to be diligent that when we have those symptoms, we don't come into work and we go get tested. Next slide. And then watch your symptoms. And this is something that we have heard over the past 3 weeks that, I think is really true, even though it's anecdotal information, but this is what we've heard. Many times we've had cases where when we've talked to them and we ask them the question, well, what type of symptoms did you have? And they've answered, I just thought it was my seasonal allergies. I have allergies every fall, and that's what I thought I had. And then they ended up not getting any better, so then they went to get tested. And in many cases, these people were still working because they felt like they didn't need to screen because it was their allergies. So our message to everybody right now is if you feel like you have allergies, please stay home and go get tested for COVID. And let's eliminate that before we go to work or we go to a gathering where we could possibly transmit the COVID virus. And also the bottom line, as we can't forget that we're public health and there's more than COVID out there. Please get your flu shot. They're available now, many different places. And we definitely want to eliminate as much of the dual virus over the fall and the winter of having both the flu, influenza in our community and COVID in our community. So please get your flu shot. And I think with that, I'm going to turn it over to Dr. Nettleton to give us some more insight into our current surge.
Good afternoon. Can folks hear me okay?
Yes, sir.
Great. So thank you for the opportunity to share some information and also some commentary as well. So first, we are experiencing a surge in cases in Calhoun County over the last several weeks. From September 22nd through 2 days ago, we've had 597 new cases. And these are most commonly being identified in the following categories, and predominantly within social gatherings. These include weddings, anniversary parties, birthday parties. Anytime we come together as human beings, as peers, as friends, as family members, increases the risk of transmission of this virus. We also note it in our vulnerable populations that live together, whether this is long-term care, whether it's other congregant living. We also are identifying cases in these type of living facilities and also living designations. We are also identifying cases related to work sites as well and related to originating from a workplace. I'm going to dive down into more of the numbers in the graph or in the table in the next few slides. So let's go ahead and move to the next slide. But before doing so, some important takeaways. So one of the greatest risks for transmission is from who you lived with. That is one of the biggest ways to transmit disease, and it's for obvious reasons. You're in close quarters, in close proximity, and oftentimes not wearing a mask. And this is what we see in school-related cases. It's oftentimes a student comes to school and the contact, the primary source of exposure has been who you're living with, brother, sister, mom, or dad, for example. But what we do see in terms of gatherings, whether it's for essential gatherings for work or in an educational environment, is that we're able to reduce the risk and spread of disease when we're following those basic recommendations that we've been stating from the beginning of the pandemic of staying 6 feet apart, that physical or social distancing, of wearing a mask and washing our hands. These are the tools we have in our toolbox to further reduce risk when we must come together for those essential functions. Let's go ahead to the next slide. So as stated, we are seeing the highest level of transmission of COVID-19 in Calhoun County since the beginning of the pandemic. In fact, our case rate is more than double than our peak in April and May. If you go to the mystartmap.info, this is the state of Michigan's website that breaks down our data by region and also by county. As of October 10th, our new cases in Calhoun County are 201 cases daily per million people. Our percent positivity, meaning the number of people who test positive out of the number of people who are tested, is 5%. Both those numbers are significantly up from where they were in the past. And again, this is due largely to social gatherings. I know there are a lot of questions about school-aged children. The highest percentage of that population where we see transmission occurring is in our older student, our high school students, grades 9 through 12. Likely where the exposure is occurring is outside school in social gatherings amongst friends or others, family members, get-togethers. Again, those grades and those youth groups are more mobile and more active than other ages are. With respect to our overall population in Calhoun County amongst age groups, we have a fairly even distribution amongst our age groups. However, the highest percentage of positives currently right now, again, not adjusted for age, but in terms of age group, are ages 20 through 29. This is a trend that's been observed in the Midwest and also in other parts of the country as well. I do want to highlight some trends from that prior table that are on this screen in front of us. One thing that is encouraging is that about a quarter to a third of our cases are being identified during quarantine. That's exactly what we want to happen. That is the whole purpose of quarantine. Quarantine is when we separate those who we believe who have been exposed from others. So when they do become infectious or do test positive, that they are away from others and unable to spread disease. So that is encouraging that we have that proportion of folks being identified during quarantine. However, what is concerning is that up to 40% of our cases do not have a known exposure. And so there are a couple of reasons that could be. One, that could be that we have increased community transmission, which we are seeing in Calhoun County. The other reason is that folks may not be sharing that information with the county health department. That does impede our ability to work with our community and further interrupt disease. And lastly, the other part could be is just in terms of reporting mechanisms as well. So we do have that proportion of folks that we do not have known exposure for. So next slide, please. So I thought I'd provide some comments about this increase in cases that we're seeing in our community. And first is that this is really hard for us to digest risk when there's such a wide range in presentations of disease and outcomes. So what do I mean by that? Well, we know folks are saying, well, I thought it was my allergies, that these are mild symptoms. Other folks have no symptoms at all. But we hear about and we know about our friends and community members who have had much more severe manifestations of COVID, including hospitalization and also death. So it's really hard to digest, what's my risk? I hear that this is mild in pretty much most people, but in some people, they get really, really sick. And some people also die. So I just want to acknowledge it's hard to digest that risk, and it's important to point out. But also to share that risk is not equally distributed amongst us as a community. We know those with underlying medical conditions are at more risk. This includes obesity. A third of our county is obese, and this is a significant risk factor for severe manifestations of COVID, as are other medical conditions, as is increasing age as well. We also know that COVID-19 disproportionately affects communities of color as well. And it's important just to acknowledge that risk is unequally distributed in our community. And therefore, the mitigation efforts as the entire community are important to do together. So I do want to share some clinical stories because we don't hear a lot about those cases that end up really sick, as opposed to those who don't get really sick. So I had the privilege of taking care of patients as a family doctor inside and outside the hospital. So I'll share 3 stories from hospitalized patients. So the first patient with COVID that I ever treated was an older person with multiple medical conditions, was doing okay on oxygen for a little while in the hospital, but one day on rounds was not doing well at all. He had a big mucus plug that in his lung that no longer allowed for him to breathe. And he had to be intubated on rounds that day and was on a ventilator for the next week. And spent another week or so in the hospital. The second patient that I had was a younger person. This person had asthma and also obesity and had to be on oxygen, IV antivirals, and steroids for a significant amount of time and be away from their family while in the hospital. And the third patient with COVID that I have treated in the hospital was a pregnant patient. Whose baby had other medical complications and therefore had to be separated from mom. And that was really hard for me as a family doctor who takes care of entire families of moms, babies, dads, brothers, sisters, to take care of her and to see that family unit be disrupted. And then for me as a public health professional to make recommendations to help further reduce the spread of disease. So I just want to share that these are our community members who are and can be severely affected by COVID. I think it's also important for us to remember that small percentages, for example, in terms of a mortality rate, when applied to large populations, still result in significant outcomes. I see this every day in terms of my work as a family doctor, in one-on-one clinical situations as opposed to being our public health physician. So in a one-on-one clinical environment, you may feel, gosh, that risk isn't too much for me in terms of death or hospitalization. Or boy, that risk seems to be small. But when we apply that small risk to our entire community, to our entire population, it does result in significant outcomes in terms of increased hospitalizations and increased deaths. And those are obviously the most important outcomes. And it's important to remember that it is not inevitable that we all get COVID-19. We have effective ways to reduce risk. This is physical distancing, staying 6 feet apart. This is wearing a face mask, and this is washing hands. It is also important to acknowledge that we do not yet have vaccine, although there appears to be several candidates on horizon. And we do not yet have much experience with treatments. We do have 2 treatments, IV remdesivir and also a steroid taken by mouth that I've used in practice. But clinicians often don't have experience with these in terms of long-term efficacy. And lastly, is that we still do not know the long-term outcomes of COVID amongst those who also recover from COVID. That is still an unknown. Therefore, this is a time for continued vigilance, particularly as our cases have increased, of washing our hands, wearing masks, and in particular, and this is what's really critical, is avoiding these social gatherings. This is really hard for us as human beings. We're social beings. We like to be with our friends and family. This is part of what being human is all about. But as our data has shown, this is where the greatest risk is occurring and the greatest risk for complications is occurring. So I like to think of the friendly Mr. Rogers when kind of approaching this as we as human and social beings, of thinking of your neighbor. The individual decisions that we make as a member of our community affect those in our families, affect our friends, and therefore affect our entire community. And I want to just reemphasize the need for us to continue to be a neighbor and to have that perspective. Thank you for me having the opportunity to speak today.
Thank you very much, Dr. William Nettleton, and of course, Eric Pessel from the Health Department. Up next is going to be our Sheriff, Calhoun County Sheriff Steve Hinckley, to talk about corrections and law enforcement updates. Sheriff?
Hey, good afternoon, everyone. Thanks for allowing me to give you some updates and some thoughts. So on the right side of the screen, you can we have our new temperature screener. That is our screening procedure we have 3 of those for intake into the correctional facility for both of our employees and our inmates coming in. And what's interesting about this, and I've talked about it before, when a person approaches this facial recognition, it actually transmits the information into the control center. So they will know whether you should be allowed into the facility or not. And it also keeps records, data records of everyone entering and their screening procedure status. We have a lot of different, so we're still transferring inmates to the Department of Corrections. So we keep all those records on hand if they need to have that data and information. So the other, some very, very good news is we have tested 1,037 total inmates as of Tuesday morning. We have only had 11 patients testing positive. All of those individuals were stopped in our quarantine process coming into the facility. We have 15 tests pending as of Tuesday. We have a pretty quick turnaround with that testing. Currently, out of all 11 positives, here's the interesting thing. We identified 11 people that either had symptoms or did not have symptoms that were coming into our facility. We were able to take all 11 people, place them into our full-time medical unit. All of those individuals have recovered and have been placed in general population. We currently have our favorite number, 0. We have 0 current cases at the Calhoun County Jail, and we have had 0 cases in our general population. Now, let me tell you another significant point to this is we feel strongly that we need to continue our programs with our inmates at the facility. We have slowed some of these programs. Some of the programs have been temporarily suspended, but let me tell you what is happening inside this facility that are pretty significant with those numbers. We are continuing our AA, our Ladder to Recovery program, our substance abuse and treatment program, our Shepherd's Embrace program, START program, cognitive education, which, by the way, we've had 131 people participate that in 2020. Our GED, we've had 2 graduates so far, Michigan Works and Spanish to English programs. All of those programs have been working, and we're still able to maintain these numbers. So I will tell you this, we stand very humbled by these numbers. We stand very guarded. We understand we've got a long way to go. We are continually changing our policies and procedures. And I will tell you that the partnership with many of you on this phone call and the partnership with the Calhoun County Health Department has really helped with our success in that area. So we're very, very proud of those numbers. We're proud of, I can tell you that we've, I think we've asked Eric Pessel the same question 5 times, and he's been very patient with us, but we understand that that we have a significant impact on our community in this facility. So we want to make very certain that we are operating with best practice all the time. So I want to, and lastly, I want to give a big kudos to our corrections staff on following all of our guidelines and procedures, and they are really the heart of the success. We can go to the next slide. So we've had one deputy who has tested positive. We've had quite a few that have showed symptoms but tested negative. We've followed our procedures and guidelines through that. The individual that tested positive is actually back to work. And one of the things that we immediately started to examine was not necessarily community spread. We called it employee spread. We were able to contain that just to him. We have continued to review our policies and how we're doing and how we're interacting with each other inside the facility. So we found that to be another success, again, very guarded and humbled in that area. For the law enforcement side, we were anticipating, some more complaints maybe about trespassing. As you remember, we have businesses that can deny service. They can ask you to leave. We have not had any, we do not have any current investigations in those areas. We continue to work with, we continue to get some questions about certain legal issues. We continue to work with the AG's office and the prosecutor's office to resolve any questions or information. And we certainly are committed and working with the community to follow those social distance guidelines. And we all want to get well, get our economy back up and running. So thank you. That's my report. Everyone have a great day.
Thank you very much, Sheriff Finkley, for that report. Coming up next is Jill Steele. She is the attorney for the city of Battle Creek, and she'll be talking to us about the state court's orders update and also the MDHHS health code orders update. Jill?
Thank you. Good afternoon. So we've had a lot of activity about the Michigan Supreme Court's opinion and decision. So October 2nd, there was an opinion from the Michigan Supreme Court that was answering 2 certified questions from the federal court. Those didn't have any direct impact on the executive orders because there wasn't a case that was before the Supreme Court to issue any orders. So there was a lot of talk of when is it effective, but really there wasn't an order. It was simply an opinion on 2 certified questions. You'll remember there was a lawsuit by the Republican House of Representatives for Michigan, and it was challenging Governor Whitmer's executive orders and the authority that she had under those. It first went to the Court of Claims, which said that the governor had the authority to do these orders under the Emergency Powers of the Governors Act. It went to the Court of Appeals, and the Court of Appeals upheld the governor's executive orders under the Emergency Powers of the Governor Act. It did not uphold them under the Emergency Management Act after April 30th, because after 28 days, you have to have the legislature's agreement about an emergency, a declaration of emergency. That decision was appealed to the Michigan Supreme Court. Not much was really happening until after the opinion came out on those certified questions, where the Michigan Supreme Court rendered an opinion that the Emergency Powers of the Governor Act was an unconstitutional delegation of legislative authority. So the case that was kind of sitting and waiting in the Supreme Court was brought up asking to have just an immediate order based on that opinion. The Supreme Court did that on Monday, October 12th, and granted that motion and reversed the decision of the Court of Appeals. So Monday, October 12th, that is what invalidated the governor's emergency orders that were issued after April 30th, and it was based on a determination that the Emergency Powers of the Governors Act was unconstitutional from the time that it was drafted. So the Director of Public Health, Director Gordon, for the state of Michigan had already issued some emergency orders. Nobody really paid any attention to those throughout the summer, and they were really just implementing, reiterating the provisions of the governor's executive orders for the most part. So the Director of Public Health's orders, emergency orders, were issued, they are issued under the state's public health code. Those have not been the subject of any of the challenges that have been brought to the court. And the state law does allow the Director of Public Health to issue emergency orders to prohibit gatherings. It also has Section 1111 says that these provisions of the Public Health Code are to be construed liberally. And so under that authority, the Director of Public Health has issued orders. The most recent one was October 9th, and it is effective until October 30th. I would certainly expect that we're going to see new of these orders issued while this pandemic continues, as he and other experts assess what the condition is that's going on. But that implemented a lot of terms from the prior executive orders. The requirement of wearing masks, reduced capacity in restaurants, limitations on gatherings, indoor and outdoor, and a variety of other things. So the Director of Public Health's emergency orders do provide that a violation of the order can be a misdemeanor up to 6 months in jail and or a fine. I think it's $500. The order provides that law enforcement officers are the representatives, can be the representatives on behalf of the health department to enforce these orders. There's also authority for the regulatory agencies like liquor control, like businesses, maybe restaurant, health department's authority to approve kitchens so that they can have, rules as well, administrative rules that are looking to enforce these concerns about addressing this pandemic. And a violation of those administrative regulations is a civil infraction, and I think it's up to $1,000 per day of violation. So there's been a lot of talk about, gee, these aren't valid either. They are, and unless and until there would be some higher court that would say they're not, these are enforceable by law. The legislature also had a number of pieces of legislation that started April, maybe some in May, to try to address some of the things that were in the executive orders, and they kind of just sat and languished. Well, since these executive orders were invalidated, there's been a flurry of activity at the state legislature, one of them being an amendment to the Open Meetings Act. And so we're waiting and expecting today that Governor Whitmer will sign that. The House approved it, made an amendment that will allow for virtual meetings. And the Michigan Senate approved it last night around 9 o'clock. So that's something that municipalities have been anxiously waiting to get that authority to hold these meetings virtually. And that, if the governor signs it, allows the virtual meetings to continue even without a declaration of emergency through December 31st. After that, there would have to be provisions that will last for all of 2021. It then sunsets, but after December 31st of this year, there has to be a declaration of emergency by either a statewide one or a local emergency. So that's my summary, and if there are any questions, I'd be happy to try to help out with that.
Did you want to discuss anything further on the next slide here, Jill?
The details about, sure. So under the October 9th Public Health Director's order, you have to wear a mask over, a covering over your face, your mouth and your nose in gatherings of 2 or more people. The businesses are supposed to be enforcing this, not supposed to be allowing people in. It's really the same provisions that we had gotten used to and that we were expecting to go into effect October 9th about the bit of an increase on indoor and outdoor gatherings. So the capacity was increased a bit. Organized sports still require masks, required in schools. And there is a provision for contact tracing that is in the Director of Public Health's emergency order.
Anything further on that, Jill?
No,
Okay, very good. Thank you, Jill Steele, very much for that report.
you're welcome.
We're going to move on to Kelly Scott, our Calhoun County Administrator Controller, to discuss the state website information and also a county courts update. Kelly?
Thank you, Dirk. The state of Michigan continues to maintain and update a pretty good series of websites on their michigan.gov/coronavirus landing page. And I'll just highlight a couple of those. It's a great place to check when you have specific questions, or if you're like me or just interested in monitoring the data trends. This site also has press releases, the emergency orders that Jill Steele just talked about, and a really large and growing list of frequently asked questions about coronavirus, about everything from unemployment questions to what's happening with the Secretary of State, to questions like, what do I do if a coworker tests positive, which unfortunately is a question that a lot of us are hearing often right now. The first item I want to highlight is the My Safe Start map, which Dr. Nettleton talked about. And if you scroll down on their landing page, the coronavirus landing page towards the middle, you can click on this map dashboard. So on September 22nd, this site switched to a new set of names to define the risk levels within Michigan. You can see the picture of that on this slide, the new color scheme. And so it was intended to reduce the confusion with the previous color scheme and numbers. Now it matches better with the state's economic recovery phases. There's also an additional higher emphasis placed on the number of cases and an intermediate level of emphasis placed on the percent positive of cases. So there are now 6 risk levels. The lowest one is just called low, and then they move up from the letters A to E, with E being the highest. As of today, the site shows that our region, along with most of West Michigan, is a risk level D, which is the second highest. The UP right now is shown at the risk level E, which is the highest in the state. And then most of eastern side of Michigan is one step lower than we are at a risk level C. Speaking of data, also a related item we didn't mention on the slide, but if you scroll all the way to the bottom of the coronavirus landing page, where there is a picture of this colored map, there's a button that says see cumulative data. And then there are several more buttons on that site that has databases tracking more specific items such as cases within the long-term care facilities and also outbreak. The latest piece added is the new required school outbreak reporting, which includes public and private K-12s, along with colleges and universities. So right now, the largest ongoing outbreaks within the schools are at where my kids are, Michigan State, followed by Grand Valley State, Western Michigan, and the University of Michigan. And then the last item I'll mention on the state's coronavirus website is the Find a Test Site button right near the top of the screen. It gives you the coronavirus hotline number to call, or even better, you can search for test sites near where you want to go to get tested. There's also a really nice filter feature that shows which ones are free, which ones accept people who do not have health insurance, which ones will test you even if you're asymptomatic, and which ones don't require a doctor's order for testing. And so if you apply all those filters, the two in our area that will meet all of those criteria are the Rite Aid on Columbia Avenue in Battle Creek and Hemingston Drugstore in downtown Marshall. So that's it for this slide. All right. So a follow-up to, we heard the city attorney talk about the Supreme Court and their jurisdiction over basically overturning the governor's My Safe Start reopening plans that were set forth by executive orders. The Supreme Court also has, by the state constitution, has direct control over all state courts, including our county courts. And they administer that through the State Court Administrative Office, or SCAO is what we call it. So our courts then, because the administrative orders put out by SCAO were not impacted by the court opinion that overturned the governor's powers, our courts continue to follow the reopening plans according to the state's reopening plans. So just a little bit of background, the county's Board of Commissioners and our administrative departments have been working with Chief Judge Mike Jacquinette and our court administrators, Chris Getting and Kate Ambrose, to make sure that we're providing adequate funding, technology, employee support, PPE, and facility enhancements within the Justice Center to allow for safe reopening. I think we're in good shape with those preparedness elements. We also know that it is a big concern of law enforcement, the prosecutor, and our public defender that the criminal case backlogs begin to be addressed. In spite of those efforts, the reality is that the COVID-19 surge within our county, different than what might be happening in other counties, is still preventing the biggest element of resuming our court operations, which is the restarting of jury trials that were originally planned to begin in person starting October 12th. So SCAO has published a return to full capacity document that continues to be updated. It's a 4-phased approach that relies on up-to-date data to assess the readiness to proceed to expanded phases of our court capacity. It, of course, is designed to mitigate the risk to the public and to our employees, and it does require courts to submit the plans to move to each subsequent phase to the SCAO office in order to get approval. So one specific administrative order that SCAO has put forth sets recommended metrics for jury trials developed in partnership with the state and local public health officials. And that was just issued at the end of September. Calhoun County's courts are currently in phase 2 out of 4. We hypothetically would be eligible to submit to allow jury trials, and that was the direction that our courts were proceeding with a target date of October 12th. Also, in order to conduct jury trials, the courts are going to have to conduct all other work remotely as much as possible to reduce the number of people in the courthouse. And then most importantly, just as a starting point, this administrative order requires us to consult with the MyStart map and the 7-day average in the county, and it must be less than 70 COVID-19 cases per million per day. And you heard Dr. Nettleton report that right now Calhoun County is at close to 200, more than double that threshold, and also less than 10% positive diagnostic tests. That has not been a problem, as we've been well below that since April, and now we're right around 5%. So each chief judge across the state has to consult with their local public health official to determine risk levels. Judge Jackinet is working with Eric Pessel regularly to talk about that. And then ultimately, the chief judge needs to decide whether to get permission from the state, depending on what measures we have in place to conduct a jury trial in a way that will not create excessive risk to public health. The courts are also required, when they're holding jury proceedings, to collect names and contact information, just to make sure that if we need to do contact tracing, there is that capability. So I think, the bottom line is the judge must rely on his confidence level in consulting with public health that we are not creating excessive risk to the public. So because of the high case count right now in both our region, which we can look at the region, and also within our county, Chief Judge Mike Jackinet has announced the cancellation of jury trials that were set to begin on October 12th. Jury trials scheduled for this week, October 19, next week, also October 19, have been canceled, and the courts will continue to monitor the case counts and continue to make decisions about jury trials in order to ensure the safety of the public and our employees. There is great information if you just Google Michigan courts. Also, our county website has a courts department page where they're trying to also provide contact information if you are scheduled for a jury trial, if you need to call or email the courts, please check that for information. Next slide. Finally, my last slide is just to mention on behalf of the county's operations and our COVID preparedness and response plans, based on the Supreme Court order that negated the governor's executive orders, and just some minor changes in the CDC's guidance regarding employee screening and some other minor changes. We will be updating our COVID preparedness and response plan, and also our employee screening forms and mobile app, and we will be providing that on our website, just because we know that several other organizations and local governments, including the city of Battle Creek, is also updating theirs. We're just trying to be as consistent as we can with those plans, and we will share those as soon as they're updated. And that's it for me. Thank you.
Okay, thank you very much, Kelly, for that report. Coming up next, our last scheduled speaker is Ted Deering, the Assistant City Manager for the City of Battle Creek, and he will be discussing the homeless shelter situation. Ted?
Yeah, thank you, and good afternoon, everyone. I am filling in today on behalf of our City Manager, Rebecca Fleury, who apologizes that she could not be here today to talk about a project that she and several other local stakeholders in our community have been actually working on for the past several months. And since the beginning of the pandemic, I think there's been a real heightened awareness among a variety of service providers and others about the potential negative impact of the virus on our most vulnerable populations, and particularly our homeless population. So the pandemic really did give us an opportunity to evaluate the facilities and the services available to support the homeless in our community, particularly the need to work collaboratively amongst a variety of groups and organizations like the Share Center and the Haven to address those concerns. And so the result of that has been an ongoing collaborative effort between a variety of stakeholders and community organizations who are supporting a new homeless shelter that is located at 209 East Michigan. And this is a new site for the Share Center, a move from their Grove Street address over to East Michigan, which is near City Hall, if you're familiar with that address, actually right next to our fire station #1. So the shelter now is currently providing 24/7 services, including day and overnight stays with meals for the homeless men and women of our community. The Share Center and the Haven are the main service providers through a contract with a new entity, Battle Creek Homeless Center, Inc., which is a community collaborative, as I mentioned, whose board members you can see on the slide there as they're identified in the lower section of that slide. If we could go to the next slide real quick, please. Thank you. So the Battle Creek Homeless Center, Inc., again, is in the process of purchasing the property at 209 East Michigan. There are some utility and other building issues that are being addressed there, including the need for some permanent bathroom and shower facilities. There are currently some temporary facilities on site, but more are definitely needed at the location in order to make sure that we're in a position to meet or to increase the capacity of that site to meet the various needs that we have to serve our homeless. There is still support certainly needed for this project. And as you can see from this slide, there are a number of requests that are still out there and pending for additional support. So next slide, please. Yeah, and as I had mentioned, there are several community organizations, including a few individuals who have been donors to this project led by the Battle Creek Community Foundation, who have come together really to support this effort financially. Most of the operating dollars to cover the expenses are being funded by public dollars. However, there is going to be a need for additional support in that area as well. So I just want to quickly acknowledge all of those who have stepped up in this time of need to make this project happen. They do need your continued support as we try to address the homeless and the housing needs of our community. Please, I don't profess to be an expert on this particular initiative, so please feel free to reach out to any of the board members that you saw on the slide from Battle Creek Homeless Center, Inc. with any questions that you may have. And of course, if you're willing to help, I'm sure they're more than thrilled to take your call. So thank you.
Okay, thank you very much, Ted, for your report. We're going to move on to comments from elected officials. We're going to start off with Senator Bison. Senator or representative? Okay, we're going to move on to Representative Jim Hodsma. Jim, are you with us today?
Dirk, yes, I'm here. Thanks for inviting me. I think Jill Steele and Kelly Scott have outlined well that which went on yesterday. I'll just make a couple additional highlights. As Jill noted, the Open Meetings Act amendment was undertaken last mid-evening. I actually left for Lansing about 7:30 yesterday morning for a transportation committee meeting, and I arrived back at 4:30 this morning. We recessed from session at 3:18 this morning. So it was a marathon session yesterday, but we did ensure that the Open Meetings Act is amended to comply with the emergency order. The Senate did as well. So that is before the governor, as someone has noted in chat, to an inquiry. We also, early this morning, about 2 this morning, acted on, I think 2, maybe 3 bills in relation to unemployment compensation benefits to ensure that the governor's emergency orders in relation to unemployment compensation benefits weren't a nullity, and the governor is expected to act on that as well. We also, this morning about 2:30, acted upon a supplemental budget item which will fund some PPE and graduated openings at the Michigan Secretary of State field offices and Michigan Works offices, so that there can be some direct contact by citizens with UIA and Secretary of State officials. So I'm pleased to be back in Battle Creek, and I'm pleased we were able to act collaboratively over a long duration of hours yesterday and this morning to get a lot accomplished and over to the governor collaboratively. Thank you.
Great. Thank you very much for your report, Representative Hodsma. We're going to move on to Representative Hall. Representative Hall or a representative? Okay, hearing none, we're going to move on to county elected officials. If we have any county elected officials that would like some time to speak this afternoon. Okay, moving on to tribal elected officials. And moving down to city elected officials. Okay, moving down to township elected officials. And finally, are there any village elected officials that would like to speak today? Okay, any additional comments? All right, next slide, please. Okay, before we get to this, I'd like to thank the PIOs for covering the chat. And I'm going to assume we're good on that. I haven't heard otherwise. So we appreciate your time and efforts with that, both Jessica and Lucy. This next slide shows best information sources. In case you want to drill deep, you can certainly do that with, these are really the top 4 places to get your information. Next slide, please. And a special thanks to Lucy and Jessica who put all of this together today and always do put these meetings together. Fantastic job, a lot of work, and it's greatly appreciated. If there's nothing further, we're going to go ahead and end this meeting today. I'd like to thank all of you very much for joining us, and I'm wishing you a pleasant day and a great week. Thank you so much.